Dear students, welcome to GAME, Gross and Microscopy Explained. This particular description will pertain to the slide alone, which is kept for the undergraduate students, BDS and MBBS. This is the clinical counterpart of the lesion, Molluscum contagiosum. The importance is given over here, kindly go through. Normally, it is present as a 3 to 6 millimeter dome-shaped structures. Look at this one, as though certain hemispherical structures are sitting on the skin. That is the way it will appear. And then there will be a central umbilication. Umbilication means a depression. And later on, there will be a rupture and the spread of infection from person to person or to different areas on the face. And this picture is also very clearly illustrating the lesion as such in a young child. We used to call it a kissing lesion. And I hope you people are able to recollect it. This is a bag. My professor used to describe it as an inverted bag of rice. Rice grains are falling out. Similarly, this is a skin from which the denuded epithelium is falling off. Hence the term inverted bag of rice. Or it can also be resembling volcanic eruption like this. Let us see what it fits into. This is the lesion which will be focused, or part of it will be focused and kept for you. This is a section of the skin. All the violet color is the epidermis, and the pale fibers are all the dermis. You find that there is the epidermis and it is thrown into lower folds. And this particular feature is called as acanthosis. Acanthosis means broad downward folds of the epidermis. And in this, as I go higher up, I am finding that the stratified squamous epithelium is getting filled with eosinophilic material. And this eosinophilic material itself, you find that the cells are getting denuded and they are getting dispersed. So, how do I describe it? These are called as molluscum bodies, and your dermatology gives it as Henderson-Patterson bodies as well. It is an intracytoplasmic inclusion. They are all eosinophilic. Look at the pink color over here. It almost fills the cytoplasm. And the appearance is like that of an inverted bag of rice. The epidermis or the epithelium can show a hyperplasia. That is what we are seeing. Molluscum bodies, epidermis, dermis. And when I go to the previous slide, you can see what it fits into, either the volcanic eruption or the inverted bag of rice. So another picture of it, I am finding the stratified squamous epithelium, and these are all inclusions which are almost replacing the entire cell, and they are getting denuded from the top. Common in children, adults it can be appearing as a sexually transmitted disease. It is due to a DNA pox virus, skin to skin contact, and sometimes auto-inoculation, very common in children. You touch it and then any part of the body it can be transmitted. This is called auto-inoculation. The picture of the same, no further explanation. And this is it. Once again, I repeat, the epidermis thrown into folds called as acanthosis. There is hyperplasia, and the layers are showing multiple inclusions in each cell. They are all eosinophilic, and the topmost layers are getting denuded, facilitating the spread of the disease. See you in game 33.